What is multiple myeloma? Multiple myeloma is the cancer of plasma cells. And what are plasma cells? Plasma cells are the transformed B lymphocytes in our body. When the B lymphocytes encounters any virus or bacteria, then the B lymphocytes transforms itself to become plasma cells, and these plasma cells then start producing chemicals called as antibodies. You would have all heard about antibodies. So these antibodies then coat the virus or the bacteria that is inside the body, and once the virus or the bacteria is coated by the antibodies, the T lymphocytes in our body will then attack these coated virus or bacteria and destroy this virus or bacteria. So in plasma cell dyscrasias, one of which is multiple myeloma, the plasma cells abnormally proliferate. They increase in number without the presence of any virus or bacteria, due to which these plasma cells, they produce lot of antibodies, and these antibodies have no actual work. So when these antibodies flood in the blood, they increase in large quantities in the blood. They will then go and start attacking and sitting on various organs such as the kidney, the heart, and various other organs, and cause all the effects of multiple myeloma. These plasma cells are also notorious. What they do is, when they are increased in large number in the bone marrow, they stop the production of the normal blood components, and they also start damaging the bone from inside. And these bone damages are called as lytic lesions that can be seen in X-ray or MRI or even PET-CT scan. So what are the classical symptoms of multiple myeloma? We, from our undergraduate days, are taught this beautiful mnemonic called as CRAB, CRAB. So C means hypercalcemia, R means renal dysfunction or kidney infection, and A means anemia, and B means bone lesions. So I will start with B. The bone lesions are due to the plasma cells eating on the bone from inside, and they can start damaging and cause lytic lesions, these punched out lesions from the skull to various other bones of the body. And once these bones are damaged, they give rise to severe pain, like how you would get pain after developing a fracture. Sometimes they can critically destroy any major weight-bearing bone, due to which you can get pathological fractures also, from which healing is very difficult despite the conventional measures. When bone is damaged in such large quantities, the calcium inside the bone is released into the blood, and when the calcium goes to very high level, it can cause various side effects and various symptoms in our body, and this is called as hypercalcemia symptoms. They can cause abdominal pain, they can cause disorders in the functioning of the heart, and so on and so forth. Now, because of the overpacking of the plasma cells in the bone marrow, you will also get anemia, because RBCs cannot be manufactured as easily because of the packed marrow. Because of the plasma cells damaging the kidneys, because of the plasma cells releasing a chemical called as uric acid, because of the increased production of antibodies, and because of various other causes, the kidney can be damaged, due to which patient can get kidney dysfunction ranging from mild to even severe, so as to require dialysis. So these are all the symptoms of myeloma. Some of the other repercussions of myeloma are that it causes the abnormal deposition of proteins called as amyloidosis, which can damage the heart, it can damage the kidneys, it can even damage the functioning of our normal intestines and cause intestinal obstruction, and so on and so forth.